Supreme Court ruling that Obama, the federal health care law was constitutional, and who may have thought that, oh, well, the court must have basically ruled that states cannot exempt themselves from the penalties and so forth of the mandate. What do you say to that?
Yeah, good question. There's nothing in our legislation that challenges what we've come to think of as Obamacare. This law works in conjunction with the language of the ACA, and in a sense, I would even say with the permission of the ACA, in order to exercise the state powers granted through the ACA and recognized in the ACA, and even state powers strengthened in the ACA. Here's a short, and some of the information that you've been given. Here's a short excerpt that I could read from. It's in the bill copy. It's line 71. It says the Patient Protection and Affordable Care Act, Obamacare, of 2010, recognizes the state's traditional powers. This is Obamacare. Recognizes the state's traditional powers to license and regulate health insurance carriers. Section 1311E of that act permits states that operate health insurance exchanges to exclude certain health plans. Section 1301A of the act reserves for all states, regardless of whether they operate a health insurance exchange, the power to exclude health insurance issuers from participation if such issuers are not licensed and in good standing to offer health insurance coverage in the state. So, if you ask me the question, are all of these references and more that I didn't mention in Obamacare there because, for instance, the president wanted to be sure that state powers in reference to regulating insurance carriers were strengthened and preserved in his bill? I don't believe that's the case. But again, that's why I mentioned the history of the bill. At that last minute, when they were scrounging about for those elusive votes that they needed, these were the compromises they had to make with those senators. And so these provisions are included in the bill. And it was those senators' intent to reserve those powers for the states. And we're really exercising those powers that are preserved in the ACA and left to the state's discretion.
So again, in other words, you think you found a way to enforce State Issue 3 without claiming that it supersedes federal law.
Exactly. Exactly.
Supremacy clause issue.
Yeah, there's really no consideration of there's nothing in here to be preempted by the federal government, since it's simply drawing from the ACA to accomplish our goal and protect the public policy of the state of Ohio.
Could this bill be viewed by a skeptic as being anti-business, since you're essentially, seems like you're limiting a revenue stream for business in Ohio to a certain extent? And as a follow-up, have you looked at what the fiscal impact would be on those businesses as a result of this stuff?
Well, I can tell you this, and you can talk to probably actuaries throughout the country, but Milliman, one of the premier actuary organizations in the world, in fact, says that if Obamacare goes fully into effect, it'll cost the average person on the individual market to see their rates increase 75 to about 120%. For employers, the penalties they're talking about charging are exorbitant, particularly if you consider conscientious objectors for religious beliefs that can't, in good conscience, purchase health care that demands certain reproductive coverage to be included in their health care. Those folks will certainly be penalized a great deal. For other employers, we're already hearing from hundreds of employers throughout the country, many throughout the state, that they're going to do everything possible to get under that 50 employee threshold in order to avoid the program. So I would say, if anything, when this bill goes into effect, Ohio will become a mecca for job creation throughout the country. I think you'll see job growth here that you wouldn't see in other parts of the country.
I could comment too.
But that's, again, well, go ahead.
I would respond to that by saying this is probably, the President's healthcare plan is one of the most devastating things businesses encounter. There are many industries that are going to be particularly harmed. We've talked about the restaurant industry and some others out there where 50 employees would be the optimal number to have to run your operation efficiently. And so you put businesses in the position of having to pretend they don't have employees they have, and to put that burden on the employees, because a lot of employees need a certain number of hours, a certain level of income to make it worthwhile for them to succeed. And so it's driving down the incomes of a lot of individuals. But we're an employer-based system for healthcare right now. So if we can do something to make healthcare more affordable for companies, then it's going to help individuals and companies as well. So clearly, when we're addressing this issue, this is something which is probably the dominant issue in a lot of states right now. I spoke last night with the expert at the Heritage Foundation. This is probably one of the most fundamental issues that we need to address for employers in terms of their costs. And if we can't find a more affordable alternative to the President's health care plan, then there's going to be tremendous distortions that we can't even anticipate. Because as you know, this is not a well-written piece of legislation the President has. It has not been interpreted. There are going to be a lot of panels trying to figure out what it means and a lot of attorneys trying to figure out what it means. What we're trying to do for the citizens of Ohio is make sure that they have a choice. And that's going to be beneficial to business as well.
What about the insurance industry itself? You guys talked about this idea, you got any feedback from them?
Just kind of, that's underway right now, and I know conversations Ron and I have had that I've not had. We're going to continue to reach out to the industry as well. I think, ultimately, I think if the President's health care plan is fully implemented and succeeds, it's going to destroy private insurance in the healthcare field. So ultimately, they need to realize that we're doing something that helps them long term to be able to continue to be players in the healthcare industry, because if you feel the sense that move toward a single payer system eventually, that's going to be harmful to a lot of insurance entities that are participating right now.
I think the reality is, too, that the insurance industry is going to receive, when Obamacare is fully in effect, you'll see the insurance industry receive huge amounts of federal money. So it might be difficult for them to take a stand against this right now. Now, if they look down the road, as Andy was suggesting, maybe some of them will feel differently. Because eventually it probably will cause a great deal of harm to the private insurance industry. But our goal right now, these questions are good questions, but our experts can't be here today. Cato couldn't fly into town. Michael Cannon, who was the genesis for this idea, his flight was canceled. So it's difficult for us to predict, what the long-term outcomes of this are going to be. My goal as a legislator, and I believe the goal of all of us up here, to protect the individual rights and freedoms of Ohio citizens and employers to choose the health care of their desire, not some government-defined program. And the only thing that would cause them to choose that program, I believe, the government-defined program, is the penalty. So we're simply trying to avoid that penalty being imposed on Ohioans.
I'll say two quick sentences. Hi, I'm Christina Roder. I'm from the 37th House District in Ohio. And I just wanted to say briefly that the people of Ohio spoke out loud and clear about what they thought about the Affordable Care Act through issue 3. And we heard their voice. And under the leadership of Representative Young and Representative Thompson, through this bill, they are taking action to try to implement the people's will here in Ohio without running afoul of any federal law. So I just commend them on their leadership and definitely support their efforts.